Hi, Natalia.
Hi, sorry, I'm just trying to get situated.
No worries. And hi, Karima. I see that you also just joined. How are you? I think you're muted.
Okay, it's good. I got on early, so I'm not messing it up during the webinar. Yeah.
Thank you for
Good.
joining. Yeah, I usually like to have our speakers kind of join a little early just so we can make sure that all of the tech, Zoom logistics are running okay before we have all of the members. Um,
Perfect.
so awesome. Thank you for joining. Camera works, microphone works.
Awesome.
And then, so I sent an email with kind of like the structure, but Dr. Russo should also be joining shortly. And so at the beginning, I'll introduce her and kind of the structure of the webinar. And then when she's done with her presentation, I'll just give you all brief introductions and let you guys kind of take the stage from there. And then we'll have some time left at the end for Q&A. And do you see the Q&A box on the bottom, bar?
Yeah.
Awesome. So that's where people can input questions. And so when we move on to the Q&A, you can kind of go through those questions. And if any are geared towards you, you can pick and choose which ones you want to answer. If there's any that are more study related, I'll be kind of monitoring the Q&A box and just typing in those answers that might be a little more on the study side of things. But that's how you can kind of take a look at what questions are coming in when we move on to that section.
So I see the like chat area, but there's a Q&A area you said?
Yes, the
Oh, I see it
Q&A,
now. It's on the top. Yeah. Okay.
yeah, yeah.
Got it.
Sometimes it's different depending on what kind of computer or version of Zoom you have. But yes, as long as you can see the Q&A box and click it and it says no open questions, which means that no one has asked any questions quite yet. That's where those questions will start popping up.
Okay. Sounds good. I'm trying to be comfortable sitting on a bed right now, but
Yeah, I thank you again for joining.
yeah, no problem. Um, just C-section stuff makes it much harder to move around. But I'm sorry, who was the other participant that's in Madison study?
That's Karima, actually. She
Okay.
is our
And
other
she's on right
response.
now, right?
hmm
Okay. And then who else was joining?
Our other panelist is Alyssa, and she is a participant at our Georgia site.
Okay. So Karima, right? Is she still on? Are you still there?
Yeah, I'm here. Yeah, yeah.
Okay. And you're going through IVF right now.
Yes, yeah.
Where are you going?
I'm still in it. I haven't had a successful pregnancy or birth or anything.
Mhm.
Sort of just in the thick of it right now.
Yeah.
So that's
What?
that's kind of the story I'll share is, ups
Yeah.
and downs, sometimes there are successes, sometimes not, you
Yeah.
know, yeah.
I was
Mhm.
just wondering who you're seeing for provider for it because I'm
Living
also
oh,
Madison.
okay.
Yeah.
You're also what's that? I'm sorry.
Madison area. So I've done
Oh,
IVF
okay.
a couple times, both through Generations and through Wisconsin Fertility. So I wasn't
Oh,
sure if you're
awesome.
going through one of them or not.
Yeah, I went to the study site in Madison, Wisconsin, but I actually live in Ohio. So Ohio
Oh,
Reproductive Medicine
okay.
is, yeah, the,
Okay.
the fertility specialist I see. So
Okay. Makes
yeah.
sense. I was like, oh, like we should talk. I can tell you who I went to and everything, but that makes sense. Okay.
Yeah.
Well, still amazing. I know it's quite a lot to go through the journey as well. So I hope for the best. But yeah,
Thank you.
yeah,
Thanks. Yeah.
yeah. We've been going through it for like 4 years.
Yeah. Okay.
But we do have two healthy babies through it. But actually, it's probably been like five.
Yay. Oh, wow.
But yeah, it
Oh,
is quite a journey, right?
it is. It is. Yeah. Well, congrats. And I
Oh
heard
yeah.
something about recovering from a C-section.
Oh yeah.
So
So
sending you healing
my
energy.
baby is 1 week old today.
Oh my gosh.
Yeah, yeah, crazy. But
Oh.
I wanted to try to help and give my own experiences. But yeah, yeah. Sorry, I totally thought that you were like going to Madison for IVF treatments. So I just
Oh
was
no, that's okay.
who you're
Yeah.
seeing. But yeah,
Now,
Yeah.
Natalie, do you have Caticil or does somebody else have
no, I
Caticil?
do.
Okay.
Mhm.
Did you have any complications with your pregnancy?
Not with this one. With my
Okay.
previous, I definitely did. Um, and so I kind of caught a gist of your story as well previously, but I'm eager to hear it. But yeah, I had extremely bad postpartum with my first baby, like really bad TIAs, migraines that lasted probably 3 months, slurred speech, weakness, everything. And so we were really debating on trying this again. And I was like, we had three, well, we actually at the time had two healthy embryos. One miscarried, and then the second one. And then we decided, you know what, we're going to try this again after we had our first. But my husband was very concerned about trying it again, obviously, because he was like pretty much a single dad for
Yes.
3 months.
Yes.
Like literally would attach the pumps to my breast to try to get milk. I mean, everything. But then we did a planned C-section this time. So I had um, been induced with my first. And
Hmm.
so I was failing to progress, and she was decelling. And so then we
Me
went into an emergency
too.
C-section. And I
Yes.
think my body just was so overwhelmed by the like trauma from it all that it induced a lot of the CADASIL kind of symptoms. So really, I hadn't had migraines too much before then, until then. And then with this one, I've always been followed by maternal fetal medicine, but we did a planned C-section this time. And honestly, just I mean, it's still a lot of stress on your body, but I think
Of course.
it made a huge difference.
Okay.
Haven't had I don't want to jinx myself, but I haven't had any migraines. I've had a couple headaches, but I mean you can get those postpartum too.
Yeah.
And this time I went into it with a plan with my neurologist, like, hey, if I do start getting these, we're going to go to like one of these couple of medications and I'm going to stop breastfeeding immediately. With the first one,
Mhm.
I was like, no, I have to breastfeed until she's a year, no matter what. So I had gone on like propranolol and things like that. Well, that did not work out well for me. My,
Yep.
yeah, my heart rate was down in the 30s at like 10 milligrams. Uh,
Oh my goodness.
yeah, it didn't work out well. So I literally was just handling them with a couple times I had to go to the ER and like get the whole concoction, but otherwise just taking diclofenac and trying to rest. So it just wasn't. And this time after baby was born, I did end up taking some of the pain medications that they offered, and I didn't do that the first time as well. So I feel like my body was just in stress and in pain. And yeah, so I'm hoping that's kind of the answer for me anyway, is to have a
Good.
complete C-section in the future versus trying to labor. Because we do have one embryo left. So our other thought was like, should we hire a surrogate for our embryos that are left? Um, right now, that probably I would try to maybe carry one more time, but I don't know in the future. But it's definitely crazy. You know, my mom has it as well. And she said her kind of symptoms, she always had migraines, but her symptoms really didn't come out until she had, I think it was me, when she was in her 20s. So I think it's pretty common for us who have CADASIL to have those symptoms progress when we are, postpartum time. But yeah.
Yeah. Yeah. My father has CADASIL, so obviously
Uh-huh.
no pregnancy experience. But
Mm-hmm.
his mother had CADASIL, and she had four
Who
sons.
had CADASIL?
My grandmother, my
Okay.
paternal grandmother,
Mm-hmm.
also had CADASIL, and she had four sons, and there are no like documented issues with those
Mm-hmm.
pregnancies. So
Mm-hmm.
who knows?
Yeah. Yeah. And your father, how is he doing?
Um, he's all right. He's had like three major strokes and lots of
Mm-hmm.
TIAs.
Mm-hmm.
However, he's also had cancer, and I think more of his current debility is related to the
Uh-huh.
cancer.
Okay. Yeah, my mom has had, I think, three strokes, but she did smoke. So we're like, okay, how much does that make a difference?
Mhm.
But yeah, she actually had her symptoms that she noticed was when she had had children as well. So
Gotcha.
that's hard. But we definitely have talked about whether or not we would do you have embryos?
I do. I have two more,
Okay.
two
And
more
you
healthy
you did
embryos.
genetic testing and everything for
Yeah,
them?
they're two health. Like I would consider myself very, very fortunate because I did one
Mm-hmm.
round of IVF.
Okay.
Ended up with 3 healthy embryos.
Mm-hmm.
And I have we did one implantation, got pregnant immediately. And so now we have a daughter.
Yeah. Have you guys, I know it's like a
I
huge,
know.
oh, sorry.
Sorry to interrupt. I wondered if we were gonna begin. My sister joined the webinar link. I'll just ask her to change her
Oh,
change her. It's okay. Join that second link I sent you so that you don't show up as a panelist.
Oh, okay. Okay. Yeah, I don't want
Oh,
to
hi.
be. Okay.
I'll send it to you. I'll send it to you.
Okay.
Okay.
Thanks. Okay.
All right. Thanks. Bye.
Bye.
Are we like starting?
Yeah, we can start. It looks like people are like starting to join the waiting room, and so we usually wait like a couple minutes before
Okay.
starting.
So it's
We
okay to
can
still
start
chat a little?
Hmm?
Is it okay to still chat a little?
Yeah, go
Okay.
for it. I just want to double check with Dr. Russo, who is
Okay.
our speaker. Hi, Dr. Russo. Thank you for joining. Just double checking that you're able to share your screen so that when we do start the presentation, you're able to kind of show it to everyone. I'm not sure if you're muted. I can see your screen, but yes.
Can you hear me or no? Yes.
Yes, I can hear you.
It's just coming in staticky, and I don't know if that's because of the headphones. If the connection is loose, maybe. We can't hear you at all now. I'm not
Yeah.
sure if maybe you
Yeah.
have to change your microphone settings in the bottom left corner, maybe. Usually it's that little arrow next to the microphone. It will allow you to change to your speakers, but
Yeah, there's like an audio button and you can select like a microphone, same as system as it appears for me, but there's like two different ones that appear on my end. So it might be that. I don't think we can hear you. Are you able to type in the chat?
or you can maybe leave the webinar and come back. Sometimes that
Yeah,
resets the audio from a headphone to a speaker.
yeah.
I know that's like my worst nightmare with leading a webinar. It's like the tech
Mhm.
fails. Is why I join like 15 minutes early because it
Yeah.
stresses me out.
Yeah, this is why we do the tech check. It's never perfect.
Yeah.
It works out since people usually don't join like right on the hour. People
Yeah.
start to like filter in about like 3 to 5 minutes after, so we don't
Gotcha.
always have to start like right at where the hour begins.
Okay. Also, yeah, Iman, if you can connect me and Natalia together in an email, I'd love to hear more about their experience because I know we might not get a lot of time on the webinar, but it'd be great
Mhm.
to just chat and
Yeah, of course.
learn from each other. Yeah.
Yeah, and I made a slide with everyone's contact information. So I'll share that slide at the end of the presentation with all the emails, and I'll also introduce you both via email as well.
Now
So
is it
you can
working?
talk off.
Can you hear me
Yes,
now?
Yay.
it's working. Yes.
Yay.
Oy, sorry. Okay. Let's
No
see.
worries.
I've had technology issues all day, so it's continuing into the evening.
Yeah, well, I'm glad
Okay.
that it works now.
Share. Now you can see my Zoom, right?
Yes. And now we
Mhm.
see
And if I
the
do,
presentation.
oh, all right. I can see
Yay.
you guys. Can you guys see the
Lovely.
presentation? And who else? Who's on the panel? It's all
And
y'all, like
yep,
Alyssa
Karima,
and
Alyssa, and
Natalia.
Natalia.
Well, welcome. Your voices are much more important than what I have to say.
I
I'm
think the audio is starting to cut out again.
ugh. If this happens, I'm just gonna move to my phone because that's what we're gonna do because I've had 2 computers fail today. So,
Yeah, you might be able to kind of join from your phone and then like mute yourself on your computer and then just like speak into your phone is what we've done in the past in like instances like this.
I think I'll just do the whole thing from my phone.
Okay. And do you
Okay.
want me to share the presentation in that case and just switch the slides?
I think I'm gonna just do the whole thing on my phone.
Okay.
Well,
Awesome.
option to switch to phone audio in the bottom hand corner of the screen, but whatever works for you. I can read off that number to you if that's helpful.
Switch to phone audio.
Mm-hmm. And then you dial this number 213.
Hold on.
That way you can keep your computer. It's totally up to you.
Okay, let me try that. What is it?
213
Yeah.
338 8477.
Karima, I'm not sure what you do for a living, but clearly you use Zoom a lot.
Yes. And then I'll ask you for a meeting ID, and that is 971 2312. Okay. 971.
Just hold on.
I'll put it in the chat also, but 971 2312.
It's,
Oh, you got it. You got it.
I got it. Just nothing's easy. Thank you though.
And I think I'll start the webinar just to start letting people in so they know that it's still happening and just let them know that we're currently just working through some tech issues.
That sounds good.
Hi, everyone. Thank you for joining. We're currently just working through some quick tech issues and then we will start our presentation. But thank you for your patience while we work through this.
I'm just gonna
Now
join.
you can mute your computer, and then we'll hear you through your phone. Or you might be able to do it on your end, Iman, is to mute her on the webinar.
Yeah. Let's see.
Okay, she might just join by phone.
Yeah. Okay. Well, we can do a quick introduction in that case while Dr. Russo joins back into the meeting. So thank you again, everyone, for joining the Codicil Consortium this evening for our webinar on family planning and IVF. Our speaker, Dr. Melissa Russo, is a specialist in maternal fetal medicine and clinical genetics, and we'll be providing information on IVF and considerations to help inform your decision. Following Dr. Russo's presentation, we will have a panel composed of 3 of our community members, Karima, Alyssa, and Natalia, who will be sharing their personal experiences with Codicil and navigating the IVF and family planning process. And we'll also save some time at the end for Q&A for any of our speakers today. And thank you all again for joining.
You're welcome.
Awesome. And then I also have Dr. Russo's presentation, so I will share it in the meantime.
Can you see me now and hear me?
Hi,
Yes,
Dr.
we can.
Russo. Yes, we can see you and hear you.
Okay, I'm gonna just do it this way because it's easier. Like
Yep.
sorry. Okay.
And I have your presentation up as well, so I can just switch through the slides whenever you're ready to move on to the next.
Okay, great. I can't see the panelists, but that's okay, I guess.
Yeah, the panelist presentation will be following your presentation, and so we'll be
Okay,
cameras off for now.
no problem. All right. Um, let me just see if I can see people. If there's a way to do that. Nope. All right, I'll just present to the screen for now. Did you already do an introduction? I'm sorry I'm late. Or
Yes, I did a quick introduction on yourself and how you are a specialist in maternal genetics, or maternal fetal medicine and clinical genetics, and kind of explained what you will be presenting on today, but you can also do a more formal and detailed introduction if you would like.
Oh, I don't need an introduction really. I mean, I'm just here to help answer questions and try to give information. Disclaimer is that I am not an expert in CADASIL, but I know a lot about, genetic testing, family planning, and, I'm familiar with the literature about CADASIL, which I think we just don't have a lot. And so, I think that the panelists will actually have a much richer, information for people looking for information. And yeah, that's it. All right. So we're going to go to the next slide, please. Oh, and I also should have said, so I specialize sort of in other rare genetic conditions that affect the vascular system, mainly the aorta. So things like Marfan syndrome, Loeys-Dietz syndrome, vascular Ehlers-Danlos syndrome, and then people have non-syndromic changes in genes that can put them at high risk for aortic dissection. So that's sort of my background of what I've done a lot of research in, and I work a lot with people in the community that have these conditions and sort of help them navigate pregnancy. So today we're going to spend a little bit of time just defining and understanding the process of pre-implantation genetic testing and in vitro fertilization. We will review just basics about pregnancy management if you've gone through pre-implantation testing and IVF. Anytime we do this, I always talk about other alternative methods, which before this, some of the panelists were chatting. Some things like gestational carrier or surrogacy. I think people have heard that term before. And then I think the most important part of this is really the patient panel with or people that have CADASIL talking about their experiences with pregnancy and with IVF and genetic testing. Okay, next slide. So there's a little bit of an alphabet soup when you hear people talk about pre-implantation genetic testing. The terminology has actually recently changed. It used to be called PGD or pre-implantation genetic diagnosis. We now call it pre-implantation genetic testing or PGT. And then there's three different types. There's PGT-A, PGT-M, and PGT-SR. So when you have an embryo that you have and you want to do genetic testing, really what we're talking about if we're looking for a specific gene change, in your cases, usually it's the Notch3 variant. This is the PGT-M, where we're looking for that change in the Notch3 gene. You can also do just the traditional or what we do typically in a pregnancy is look for things like Down syndrome, extra chromosome 13 or 18, and then we can look for sex chromosome disorders. That can all be done at the same time, which is really PGT-A, or it's like a screening test for the most common aneuploidies or where there's extra or missing chromosomes. And then the third type is sort of a newer type for people where they have something called a balanced translocation on a chromosome. And that's used for people that are at high risk to pass on too much or too little information. And we can look at the embryos before they would implant for that. Next slide. And so really in this case, go back one. Sorry. I just want to, like, what we're going to be talking about mostly with this condition is PGTM. Okay, next slide. And so with these three different types, you know, a lot of people that go through pre-implantation genetic testing do not actually do CVS or amniocentesis, which is a diagnostic test we would recommend during pregnancy. But this testing that you do on the embryo, it's we're going to go over, it's pretty accurate. It's just not the same thing as taking cells from the actual fetus. And so we always recommend that some type of confirmation testing be done, whether that's during pregnancy, which could be the CVS or amnio that I'm going to talk about on the next slide. Those do have a little bit of risk to the pregnancy. So some people just wait till the baby is born, and then we do postnatal testing to confirm that everything we found in the embryo is correct. Next slide. So these are the diagnostic testing methods that we use during pregnancy. The first type on the left is called chorionic villus sampling, or CVS. This is where we take a sample from the placenta in the first trimester. We do it either with a small needle through the belly under ultrasound guidance or through the vagina going through the cervix. The way you do it is really dependent on where the placenta is, and we want to do it the safest way possible to get a sample from the placenta, which is 99% the same as the baby. That's sort of the same testing that we're doing with PGT, and I'm happy to talk about if people have questions like, well, why is the PGT not thought to be diagnostic? But this is. But anyways, in the first trimester, around 11 to 14 weeks, we do this. And then we can, in the second trimester, anytime after 16 weeks, typically this test is done between 16 and 20 weeks. We actually take a fluid sample from around the baby. There's cells from the baby, and we can look at the baby's cells and do genetic testing. With both of these tests, there's risks of loss of the pregnancy. With the chorionic villus sampling, typically that risk is about 1 in 300, meaning that when you do this procedure, 300 people had the test, one would lose their pregnancy. Whereas with amnio, the risk is about 1 in 1,000. And I don't usually call these things high risk or low risk anymore. I think risk, when you hear numbers and think about this, some people want to take no risk, and that's totally reasonable. And I think if that's the case, we just recommend that the baby does have confirmational testing to make sure that the testing you did on the embryo is correct. Next slide. So these are examples of single gene disorders that can be used to do pre-implantation genetic testing. I put CADASIL at the top. Next slide. And the main thing is to do testing on an embryo, you have to know the actual gene change in your family. And if we don't know that, then we can't do this testing. So it's really important that you know the genetic change that's in your family in order to do this testing. Because if you don't know that, if you get a negative test, it's not actually going to be helpful because we don't know exactly what we're looking for. Okay, next slide. So this is just the general procedure of what is done for pre-implantation genetic testing. In order to do this, we first have to do induction with medications. There's hormones that are given to sort of rev up the ovaries. And from there, they do an egg retrieval. And then with the eggs, there's also a sperm sample. In some cases, the sperm can be injected into the egg. That's what ICSI is. And then when the embryo is sort of at the 5 to 6 or 5 to 4 to 5 cell stage, that's when the biopsies are done. And then all those embryos that have been biopsied are frozen. So then you can do the genetic testing and then determine which ones would be put into either the mother or into someone else who is a gestational carrier. And then that would go forward with the pregnancy. Next slide. So this is just a historical slide to show you that a long time ago, they used to sample something called the polar body. which was sort of this little part of the egg that came off, and that would be sampled for genetic testing. Then we started sampling something called the blasphemere, and now we sample actually the trophoectoderm when the embryo is about 4 to 5 cells. And you can see on that slide on the bottom, the trophoectoderm really is just the early placenta. So it's very similar to CVS. And it's very much representative of the genetics of the baby, but it's not 100% accurate. Next slide. So there's lots of different testing that can be done after you've done this pre-implantation genetic testing. What we're talking about tonight is really CADASIL, which is done with sequence analysis. Usually we will have a known genetic or pathogenic variant or change in a gene that's in the family that you're looking for. And I think you guys probably will be able to speak to this better than me, but a gene change with this condition we don't know always what it means, because in the family there can be sort of different severity with the same gene change. And there's sort of a spectrum of disease. So you can just know that that gene change is there, but you may not be able to know exactly what this would mean for a person that would have this condition. Okay, next slide. I think a really important person to work with, whether this is with your reproductive endocrinologist or with the maternal fetal medicine doctor, is a genetic counselor. The importance there is they can sort of help with getting all this genetic testing coordinated. They can talk about the residual risks of after doing this testing. They can talk about all the different ways we confirm. They sort of give social support and can really help with facilitating this whole process. Next slide. And just talking about if you do IVF in general, there are just some risks to think about versus somebody that conceives, just in the traditional way. When we have the embryo that's first growing in a dish and then goes back into the uterus, that's a different environment than has traditionally been there. And so there's a slight increase in structural anomalies, especially structural cardiac disease or heart defects. There's a slight increased risk of things called imprinting disorders, which can change sort of the structures around the DNA. And there may be a slightly increased risk of sort of adult chronic diseases with IVF, but this does not mean you cannot have a healthy pregnancy. Many people have very healthy pregnancies with IVF. It's just there's this associative risk with some of these things. Next slide. So with these risks, we want to do a little bit more watching of the pregnancy. And so we already talked about this, but we would like to have some type of confirmatory testing. And again, a lot of people, it sort of depends on what you want, and you can do that genetic testing during the pregnancy. We do recommend amnio over the CVS because it's not the actual fetal cells, it's the placental cells, or postnatal testing on the baby. And then because of the structural heart defects that I talked about, we do something called a level 2 ultrasound, which is at 18 to 20 weeks, where we look at all the structures in the baby with ultrasound. And then we do another ultrasound a little bit later, around 22 to 26 weeks, where we look in more detail at the heart views, just to make sure there's no evidence of structural heart disease. Next slide. And so I looked into the literature just to see what is out there with people who have CADASIL and then choose to have a pregnancy. This is a rare condition, and I think you guys, again, I'm glad that you all sort of hopefully met each other and there's a way for you to connect. There's not a lot of studies out there for moms who have this condition if they then carry the pregnancy. There was a study out of Italy about 50 people with 93 pregnancies, and CADASIL was not associated with higher rates of complications during pregnancy. And based on European guidelines, they haven't really recommended that people be on stuff like anti-thrombosis drugs during pregnancy, sort of like Lovenox or heparin, which are injectable medicines. But I'd love to hear from people that have carried pregnancies with CADASIL, because in that Italian study, nearly half of the patients were on some type of antithrombotic therapy. The other thing from this is that vaginal delivery does appear to be safe. That's not saying everybody has to have a vaginal delivery. It's sort of whatever is best with you. And you should have a multidisciplinary team taking care of you, and that's going to be maternal fetal medicine, potentially it's going to be your neurologist, the anesthesiologist, and all these people will help you have a safe pregnancy. And there's not a lot of data on babies that have and are, like go through a pregnancy and then are born with this. There is some newer things coming out where we see sort of these rare complications in babies and we don't fully understand it, which this small vessel disease may be related. But again, in these studies that are out there, they haven't really talked about a lot of problems in babies with this condition. Next slide. And then I just talk about this because really, our job as the doctors is to give people information. And then we do talk about sort of risks in a pregnancy, but I've really changed the way that I talk about this. I like to sort of do shared decision making with people that have these conditions. I think it's a very personal choice of whether to have a baby, whether to do genetic testing, whether to carry the pregnancy or not. And there's lots of ways to become a parent. And I sort of try to work with families to figure out what is the best way for them. And that's it, I think. Oh, and the last slide, sorry. This was just sort of another slide just talking about, if you want to have a baby and you have this condition, I think it's just really important, again, to meet with all your doctors ahead of a pregnancy, sort of plan it out. There's not a do this, don't do that, especially because there's not a lot of information out there on people that have had this and have pregnancies. And so it's important just to work with your doctors. And then next slide. Now, the most important part of this is really just going to people that are living with these conditions and their experiences with pregnancy and IVF. Thank you.
Awesome. Thank you so much, Dr. Russo, for that very informative presentation. We can now move on to our panel, which consists of 3 of our community members who are also participants in our study, who will be sharing their experiences with CADASIL, navigating the family planning process, and navigating IVF as well. And I will have them, Karima, Alyssa, and Natalia, whenever you're ready.
All right. I noticed there were a couple of questions in the Q&A, and I know I won't be able to answer them. I didn't know if those were directed to Dr. Russo, and if we needed to answer those before we start the panel.
Let's see. Yeah, I think maybe it'll be best, Dr. Russo, for you to kind of answer any of these questions before we do the panel. And then we can have the panelists maybe separate.
Sure. I just looked. And so in terms of somebody asked about what is the percent, I'll just repeat the questions for people that don't have the chat. It says, what's the percentage of IVF babies that have defects? And I think when we think about any kind of congenital defects in babies in general, the general population risk is 1 to 2%, where pregnancies with IVF are 3 to 4%, right? And so if you do mathematics, statistically, that's a higher percentage. But then when you think about that globally, is that really much more than the general population? And then let's see, the next question was, you may have answered this, but is there a higher incidence of placental defects with CADASIL? For example, preeclampsia. There was not in that study any evidence of a higher risk of something called preeclampsia, which is a disorder of the placenta, in that we think there's an abnormal connection of the placenta. And what preeclampsia is in pregnancy, you can get high blood pressure, you can spill protein in the urine, people get headaches. And I know you guys will talk a lot about migraines. And if this is not treated, then it can be very dangerous to the mom and the baby. The dangers in moms, they can get seizures, they could get stroke. But there's not necessarily an association of this condition causing you to have a higher risk for that. Um, but if I was managing someone with this, I would probably put you on something like an aspirin that sort of prevents early preeclampsia, because we do that for a lot. Um, let's see. And then the third question was, what were the disorders associated with the babies of CADASIL moms? That has not been reported. I don't know specifically if it was CADASIL in some of these things, but we will rarely see like in utero strokes in babies. But I can't really speak to say that those are CADASIL. There's a lot of small vessel diseases out there. But I think this is one of the things that I would sort of think about. And there's now a panel of genes that can be sent when we're worried about a baby having a stroke in utero, or if there's a bleed in the baby's brain in utero. I think those were all the questions. Oh, there's one more. Would you recommend Lovenox during pregnancy? I think we should listen to the panelists first. I think really it's a conversation with your doctor and all your specialists, because it's not unreasonable if you've had a stroke or a TIA prior to talk about prophylactic Lovenox. But there are risks with being on those medications as well, that you can have a higher risk of bleeding in pregnancy. And so based on what I saw in the literature, I'm not sure that that's really a recommendation that all people with this should be on Lovenox during pregnancy. I think it's a very individualized decision that you make with your doctors. All right, I think that's all four now.
All right. Awesome.
All right.
Great. Thank you again, Dr. Russo, for that presentation and for answering those questions. In that case, we can now move on to our panel, which is composed of our three community members, Alyssa, Karima, and Natalia, who I will let introduce themselves quickly before moving into sharing their experiences.
Okay, great. I'm Karima Samadi. I live in Columbus, Ohio, and I am part of the CADASIL consortium with my two sisters who are also on the webinar, and we go to University of Wisconsin, Madison, and we just went this past summer for our second visit. So thank you for having me.
Hey, my name is Alyssa Vaughn. I am from Atlanta, Georgia, and I am part of the CADASIL consortium here at Georgia State University. And my brother also goes to Georgia State University to get the same testing done.
Oh, can I start talking? I'm so sorry. Okay. I'm Natalia Chapman. I am a part of the study at UW-Madison. So is my mother, and I believe my aunt. So we've all been a part of the study for, I think I was the first one maybe in the study, at least at Madison. So for a while now, at least 3 years. Yeah. Did I miss anything?
I don't think so.
Okay. And then I think I'm going last, maybe?
Yes.
Yeah.
Okay.
We have sort of an order to our story sharing, which will make sense. But I'll kick us off. And thank you, by the way, everyone, for having panelists join. I think it's so important to talk about this, especially nuanced subject around pregnancy with a rare disease. They're often not studied very much. There's not a lot of evidence. So having communities like this who talk about their experiences is invaluable. And thank you, Dr. Russo, for sharing all the science and the medicine behind it. Really helpful to have specialists like you out in the field. Again, just as a patient, it's really invaluable. So I have a positive notch 3. My father was the first to have a known CADASIL in our family. He had just a mysterious stroke disease, otherwise was healthy. And it wasn't until the last 3 years of his life that we discovered CADASIL. And at that time, and he tested positive for the notch 3, or is detected rather, I should say. And then my sisters and I, were 3 sisters, and I'm the oldest, decided to get tested. I have the Notch3 mutation. My two sisters do not. And I thus far am asymptomatic. I don't experience migraines, really no other symptoms occasionally. And I think just because I'm hyper aware and I'm paying extra attention, I might have like a dizzy spell. I might, perhaps that's vertigo, maybe something else. I often, and a couple times just had like maybe just a little like weird little brain episode, but nothing diagnosed, nothing that's shown up so far in any labs. So I'm sharing my journey. I'm still in the thick of CADASIL. Like with what Dr. Russo showed with the process of IVF and artificial reproductive therapy with the hormones and the shots and all that. Last year, I had 3 rounds of that. I am 39. So technically, if you're after the age of 35 or 36, you're, typically have to be cognizant of your reproductive system and hormones and egg reserve and all that. So I had 3 rounds of IVF and 4 failed implantations. So unfortunately, I have not had a successful pregnancy yet. I still have 2 embryos that are CADASIL free. And those are, in the freezer. We're currently deciding what we want to do. If we want to maybe, I've now switched reproductive medicine clinics, and I'm thinking about right before I hit 40, maybe doing 1 more round of IVF to get a couple more embryos. But we've discussed a lot of options. We've discussed surrogacy. And I did have a positive BCL6 that was detected, which again, I'm asymptomatic for endometriosis, but is that a contributing factor? Could there be issues with infertility due to CADASIL? It's unclear. So we're still kind of in that discovery phase. Those of you who are also starting your family planning journey with CADASIL in mind, I'm here with you in that journey, and here to learn also from others on the call. So excited to hear what others have experienced. But yeah, that's kind of where I am with it. Taking a little bit of a break here, and hopefully starting the new year with another fresh set. Folks might ask if I've been tested for any other infertility factors. I got tested for antibodies, and those all came back clear. So really, it's unfortunately, like my father, I'm a bit of a medical mystery right now as well, but still hopeful, still have those 2 embryos. I know the one is male and one is female, which, hey, if we can have both of those, that would be great. But since we've had 4 failed implantations, we just thought we'd hit the pause button and figure out what's going on. But grateful for my family. My sisters are super supportive. My husband, of course, my mom. So I have a great community of care around me, and hope to be able to contribute to that to those of you on the call as well. So yeah, I'll pass the mic to Alyssa now to share her story.
All right. Thanks, Karima. My name is Alyssa Vaughn, as I said before. My husband and I are super fortunate. We did 1 round of IVF, had 3 healthy embryos, and we now have an almost 2-year-old daughter. We found out, so I kind of knew for a long time that CADASIL was in my family. My grandmother had this mysterious stroke disease, and we couldn't figure out what it was, and it was in 1993. And so after she passed, my grandfather donated pieces of her brain to 2 different universities to try to see if they could figure out what was going on. And the researchers there were like, well, there's this interesting research out of Paris. We don't really know. This could have something to do with it. So they sent her brain tissue to Paris, France, where she was diagnosed with CADASIL. So then moving forward, my dad started exhibiting some symptoms. He had his first major event in 2005. I believe he had been tested 2 times prior, and they were both negative because they were doing skin biopsies. And maybe he also had a genetic test. I'm not entirely sure. I do know that he got an official diagnosis in 2005. At the time, my parents chose not to have my brother and I tested. They decided that that was our decision as we get older. So when I got engaged and was looking to get married, I said to my husband, this is the opportunity to get out now because if I'm positive, this is really going to have an effect on having kids. And he decided to stick around. So we got married. And then in October of 2020, I went ahead and got tested. November of 2020, I got the diagnosis that I also have CADASIL. My personal kind of history with it, I am not asymptomatic. So I started having migraines with auras at the age of 15. And when a 15-year-old girl walks into a clinic and says, I'm having migraines, nobody bats an eye. That's just kind of typical. And at the time, my neurologist said, if I had to put money on it, I would say that you do not have CADASIL. And so all of us were pretty shocked when I got the diagnosis back. That being said, my brother, who is not on this call, but I'm sure will listen later, also got diagnosed with CADASIL through genetic testing. However, he is a officer in the Navy and is a nuclear submariner. So I don't know how much you know about CADASIL, but one of the things that they advise is having a low stress lifestyle to help. And he definitely does not have. And he has the occasional migraine, but it's really nothing that common. So like I said, we did one round of IVF. We did PGTA and PGTM. We did both of those out of Reproductive Biology Associates in Atlanta. And Cooper Genomics out of New Jersey was the genetic firm that we worked with. So kind of like talking about attrition, because I was not fully aware of how that all happened. So during my IVF, I had 23 or 26 eggs that were harvested. Of those, 11 fertilized. And they did the ICSI for them, but only, 11 were successful. And of those, 5 grew to the point where they could actually sample to be sent off for genetic testing. Of those 5, I have one chimeric, meaning that it has kind of like a mix of different genetic features. One that was positive for CADASIL, and then 3 that were negative. 2 girls and a boy. So we went ahead and had the first implantation took. We were extremely fortunate. Pregnancy. So first trimester, it was everything that everybody told me it would be. I was exhausted, but I wasn't really having any CADASIL effects. It was an easy pregnancy. Second trimester, I don't think my refrigerator's ever been cleaner than when I first got it, because you get that surge of energy. And then the third trimester hit and everything went down the tubes. So as soon as I hit the third trimester, I started having weekly to biweekly migraines. They were loss of speech, tingling, numbness in extremities, lots of different symptoms. So prior to being pregnant, I would have migraines, and my migraines were complex and did mimic the symptoms of a stroke. So I could go through like being totally numb in like my left arm, then it would be my left leg, then it'd be my right leg, then it'd be my right arm. And it would just kind of go around my body, and I could time it. It was exactly 4 hours every single time. Pregnancy, things got a little different. Sometimes I'd have migraines that lasted a lot longer than 4 hours. Sometimes it'd be like 30 minutes and I was good to go. So that was really hard. My blood pressure during pregnancy, I know somebody asked about preeclampsia in the chat box. So when I first got pregnant, I was sent to maternal fetal medicine just because my OBGYN was like, I don't know anything about this. I'd rather you go to maternal fetal medicine, if nothing else, just so they can keep a closer eye on you. So I went, and they, pulled up the same study from Italy that all these women had pregnancies, and they were fine. And I was already on an 81 milligram a day aspirin. So they did not recommend any other anti-clotting medications. And so around 30 weeks pregnant, my blood pressure started getting pretty elevated. And my OBGYN clinic was kind of blowing it off. They're like, oh, it's white coat syndrome. Oh, it's, whatever. And they would always have me lay down. and like lay on my left side and see if my blood pressure would come down. And it always did beautifully. But I am an ICU nurse. So my mom's like, you're not having white coat syndrome. You are a white coat. So like I definitely wasn't nervous about being in the doctor's office. Um, so that kind of got blown off. And that was, it was fine. So then at 35 weeks, I started experiencing just like the worst migraines I've ever had. And I went ahead and went to the hospital, and they ended up hospitalizing me for preeclampsia and put me on hospitalized bed rest until 37 weeks. During that time, I had a neurology consult with with one of the doctors who I knew I delivered at the hospital I work at. And I know he knows about Catacil. But they also watched my blood pressure and all that, and I wasn't allowed to move. And the plan was to induce me at 37 weeks. So at 37 weeks on the day, we went ahead and started the induction process. And I went into labor, and I was pretty much fully dilated, and they had me start pushing. And then my daughter started having massive D cells. And I had told the doctor, the OBGYN, prior to the pregnancy or prior to delivery, I said, I am a low risk for low threshold for C-section. If you think that's what's healthiest for me and the baby, you need to go ahead and do it. So she did. And we ended up going into an emergency C-section, and Jordan was born. So she was born August 16th or April 16th. I'm sorry, April 16th. And then we were discharged April 18th. I'm pretty sure that I was having a stroke when I was discharged. But because I have this history of the complex migraines, I have gotten really good at hiding it from everybody except my family. And so I was just like, yeah, it's fine. We'll go home. We'll be fine. So then that was the 18th. The 20th, things really went downhill, and I ended up going to the ER, and that was my first stroke. So then 2 days, I stayed in the hospital for 2 days and came home with a prescription for labetalol. And being an ICU nurse, I know you can always give a blood pressure medication late, and you don't have, but once you give it, you can't take it back. That was one of the most important things I was ever taught. But I was a new mom, and I had just had a stroke. I wasn't using my nurse brain. So my husband took my blood pressure that's on one morning, and it was totally normal. And he was like, well, I don't know if I should give this. So he called the OBGYN's office, and they were like, yeah, go ahead and give it. So he did. And then my mom encouraged me to get into a hot shower, which just vasodilated me out. And I almost passed out in the shower. And the pattern of that stroke, that ended up being a stroke as well. I went to a different hospital with like a more robust neuro team. So I went to Emory University here in Atlanta for that stroke. And the damage pattern of that was a watershed stroke, which is very similar to the damage pattern seen in patients who have had cardiac arrests because of the way that the blood vessels in the brain work. So it really had to do with the hypotension and the lowering of the blood pressure too much that caused the second stroke. So needless to say, my maternity leave was spent in physical therapy and speech and cognitive therapy. And I have almost no deficits, which is wonderful. That is one thing we have learned from my dad having so many events, is that the recovery time for the Catacil strokes is generally a lot less, which is very fortunate. But we have been advised by my neurologist and my OB to not try to have another pregnancy. That being said, I would never discourage anyone ever from trying to get pregnant and doing this method. I think it was the right move for us. Although not cheap. Like I said, I'm an ICU nurse. It happened to be during COVID, and that's very lucrative for ICU nurses. So I worked like 6 to 7 days a week to be able to pay for IVF. But surrogacy is just unreasonably expensive, and that's completely out of the question. So we are going to just spoil the one that we have. All right. And then Natalia, I think it's over to you.
Yeah, thank you for sharing your story. I think everybody can hear me fine, correct? So all I see is Alyssa's face. Okay. So yeah, I'm Natalia Chapman. I'm a part of the CADASIL study in Madison. I can give a brief history of kind of how we found out that I had CADASIL, but if there's any like further questions, please feel free to ask. But similarly, we were family planning. My mother had started to have some kind of declining symptoms and actually like a lot of dementia type of symptoms. And she was very young. She was like 50. And I was in PA school and I just got married and we started family planning. So we also had found out that her dad had like a lot of these strokes and stuff at a very young age. So we knew something was going on and we had heard about CADASIL kind of through some of her distant relatives. So she got tested first and then came back positive. So I decided to test before we were going to family plan at all. So I tested positive. My sisters did not get tested. One of them has diagnosed MS, and so she's very scared to find out if she has another like neurodegenerative disease on top of her MS. But she truly has had all the band testing and spinal taps and whatnot that does show MS and doesn't show the same kind of MRI symptoms that we do with CADASIL. So she, and then my other sister had already had all of her kids. So both of them are like, we're not going to get tested right now, but when our kids are ready to have children, we will go ahead and get tested so that they know. So anyway, we decided the best route to go was to do IVF. So everybody's journey is so different with IVF. Depends on, your age and other genetic factors and whatnot. But we have gone through 3 different rounds of IVF, 3 or 4 at this point. I don't even know. And we've gone to a couple different places for it. But we just had a baby last week. So we have now 2 children. The first time going through IVF, we had an unsuccessful transfer. And then our second one was successful. My pregnancy was very smooth. I've always had low blood pressure. It sounds like it's kind of a common theme in CADASIL from the people that I know, but I could be wrong about that and just make an assumption. But I, of course, did the 2 aspirins per day to prevent any clots the best that you could, but otherwise there was no other like anti-thrombosis kind of medications or anything like that on board. My IVF doc made me meet with the neurologist first before they felt comfortable, even, pumping my body full of estrogen, which could cause clots. And essentially all the neurologist did was say, like, do you understand this possible, could possibly cause clots, could possibly cause your worsening migraines, all of that. And we're just like, yeah, but we really want to do this. So each time that we've gone through IVF, we've had to re-meet with my neurologist to just write a note like, yep, she's comfortable with this. She knows her risks. It is what it is, essentially. But yeah, so the first pregnancy went really well. And it wasn't until after birth postnatal, that I started having symptoms really bad. And honestly, I hadn't really had symptoms before that. I had like a couple of migraines, but I never associated it to being a part of CADASIL. But we were induced. I never had high blood pressure or anything like that. And she just failed to progress and she was decelling really bad. This is our daughter that I just, was in the process of having. And so they had to do an emergency C-section. And I think just from my body being so stressed out for over 24 hours, I really think it triggered a lot of my CADASIL symptoms. After that, I started having episodes of slurred speech, numbness, tingling, really couldn't communicate. And those symptoms went on for months after having my baby. There wasn't really, I was so bound and determined to breastfeed that there wasn't really any migraine medications that I could be put on that were safe in pregnancy, except for maybe propranolol to prevent, which is another blood pressure medication, which just lowers our blood pressure more. And that was bad. And I was just getting bad symptoms from that. Now, that's not going to be everybody's case. Some people need to be on propranolol, and like in Alyssa's situation, some people need to be on that blood pressure lowering drug, but we didn't. And it was dropping my heart rate into the 30s on a very small dose. So I don't I was like, hey, this isn't working for me. So I just handled those with like diclofenac, a really strong ibuprofen. And then after about 3 months, those like slowly dissipated and I didn't have any more symptoms except for a migraine here and there. Thank goodness. I had also, similarly to Alyssa, I kind of hid my slurred speech and stuff from the nurses. I'm a healthcare provider. I really did not want anybody to say that I couldn't go home with my baby. Excuse me. So that was scary. And we do that. And that's just, not the right thing to do. You really need to advocate for yourself. So, like, coming into the second pregnancy, I had a much clearer picture of, what I wanted, whatnot. So we did a planned C-section this time, still went through all the IVF stuff. And I haven't, knock on wood, had any symptoms with this one. I didn't have the same stress on my body. Not to say that C-section isn't, not stressful, but having a planned C-section seemed to be a better route for me. Is that going to be for everybody? Probably not. But this has been a whole different ballgame. We had talked about doing possible gestational carrier for our 2 embryos that we had left before this one. So we have 1 embryo left. And I decided I wanted to try one more time with like the planned C-section and everything. So now we have to decide if we're going to try to transfer our last embryo, and if I will go through with a gestational carrier or, not. It's just so unknown. It's just something you really need to be open with. But being your best advocate, I think, is huge. Going into the pregnancy with a plan. For the first time, I was like, no, I am laboring, I'm doing this. And then, we had to do the emergency C-section. But I do wonder with the first one, if I hadn't labored and put my body through the extra stress, would I have had those symptoms? I don't know. I have to say, my mother did say, she also has Capicil, that she started getting her symptoms within the postnatal time frame. She had thought she had her first stroke at that time. I think they're all TIAs. Looking at her brain MRI and whatnot, she's had like 3 major strokes. But same with me. I haven't, as far as I know, have any major strokes, but I definitely have these like severe migraines and TIA like stroke symptoms. But I can definitely get into more of like the IVF process if people have more questions about that. Essentially, they told me with my age, only half of my embryos or half of my eggs would be good, right? And then from that what they've harvested for eggs, only half of those are going to fertilize and become the embryos, and then half of those are going to have Cadacil. So essentially, they said whatever we get fertilized, a quarter of those are going to be healthy, non-affected, so non-Cadacil embryos. So that was true for us about the first round we did. I think we got 6 embryos, and we had 2 healthy embryos that were non-affected. The second time we did this, we got 8 embryos, but none of them were healthy or none of them were unaffected. And I mean, that's just something that can happen in general with IVF. It just is harder because we have Cadacil, so there's even more factors playing a part. But that was a really big blow. And so if people have more questions about the IVF process, I can go more into that and what we think happened. But essentially, I think I was hyperstimulated, stimulated too long, and it affected our embryos from being healthy. And then with the last round, I believe we had 6 again or 5. 2 of them were unaffected with Cadacil. But we had a couple mosaics in there, which have mixed kind of findings. And one of them was a high mosaic, I believe. So our IVF team was like, we're not going to ever even attempt to put that or implant that, transfer that, because we really don't know with that one, because it wasn't, just a low mosaic. So we do have 1 embryo left. We had 1 failed transfer. So we've been doing this for a while, but at this point, I was like, my body can't take any more hormones or transfers or anything like that. So we'll figure out what we're going to do with our 1 embryo left. We will use it. Personally, that's just what my husband and I have talked about. Like, it's a healthy embryo. We really want to use it. We've got to decide, am I going to carry 1 more time? Maybe I'll be able to find a surrogate or a gestational carrier. But yeah, sorry, I kind of talked in circles, but I hope that all made sense. So far, we are 1 week our baby is 1 week old and things are going well with this one. And our first one, she's doing very well as well. I just felt like I really couldn't. I wasn't, my husband was kind of a single parent for about 3 months after birth until I was actually about 3 months in and feeling better and could parent my baby. And then I had to go right back to work. So that's hard too. But yeah, I hope that it was helpful and I'll try to answer any questions.
Awesome. Thank you all for sharing your experiences. I'm sure it means so much to our community members. And yeah, we do have some questions in the Q&A box. I also see Dr. Russo is raising her hand.
Yeah. Oh. I can't, it says I can't start my video. Can you hear me though?
Yes, we can hear you.
The one thing I wanted to say is, this is of course expert opinion, but sorry, my family is around. But it's sort of a similar thing where it sounds like, we don't know if there's hormonal effects that sort of affect when there's events. Sorry, can you guys hear me with everyone in the background? I apologize. I have to have my phone plugged in right now. This is just life. Okay. I will plug it in, I promise. But just when I have people that are going through IVF, my expert opinion is if you're trying to have less estrogen around, you can ask the IVF specialist to use something called letrozole. They do that. It's an estrogen blocking medicine. And what it does is you have less effect of the estrogen. You will get less eggs. So there's less of a chance of this overstimulation. Again, there'll be less eggs to harvest, but anybody where there's this concern that hormones, whether they're going up or down or changing, there's never going to be a study that says this is safer or not. But this sounds like a similar condition where we think about hormones. And so it might be something to bring up and talk to your, IVF specialist about.
Awesome. Thank you, Dr. Russo. And another question that we had, which I think we had two questions that are kind of related, so I'll combine them for our panelists. Someone asked if the panelists ever considered not going through the IVF process at all, and we had someone else ask, how did you approach the conversation with your partners about family planning and potentially passing down the disease to your children? I think those two are kind of related, so it made sense to combine them if you had any advice on that question.
Just say I knew, having seen our dad go through CADASIL, that I wanted to eliminate it from my bloodline if possible. So even prior to getting married, I discussed with my now husband, and we knew that if we were to have children, it would be through IVF, and we didn't want to risk trying without. And yeah, I think beginning that conversation with your partner as early as possible, because it is a process. I think on average looks like we're at about 2 years with Alyssa, Natalia, and I, sometimes 3, from when you begin to when you may be successful, and everybody's different. Like Dr. Russo says, it's not one size fits all, even though there's a protocol. Everyone experiences the hormones, everyone's body, eggs, everything's different. So start early, advocate for yourself. No one's going to know how to work with you perfectly because this is a rare disease, but trust your gut, get second opinions, join a community, and share your experiences like we're doing on this call.
Yeah. Sorry, go ahead.
Oh, I was just going to say, speaking to the idea of not doing IVF, my first degree was actually in genetics. So I knew a whole lot about genetics and how CADASIL went down, even though it's autosomal dominant. If you did Punnett squares in 9th grade, you should be able to understand how it goes. But either way, my husband and I had talked about it, and we talked about it actually before we got married. And so my husband and I are high school sweethearts. We've been together since we were 18. So we had a long time to kind of discuss, like, what do you think? What would you do if blah, blah, blah? And we really didn't land on IVF being the solution until after the diagnosis. We originally were like, we're either going to have kids if I'm negative or we're going to adopt. And then we started kind of like browsing through adoption agencies and things like that. And some of the things we saw were just like, I felt like I was looking at puppies in an animal shelter because they would have like pictures of the kids and like, please adopt me. And I was like, this is terrible. Like, I wanted to adopt every single one of them. Um, and then I also knew people who had been waiting forever to like get a young child. And I think what I was most scared about when I first got diagnosed with CADASIL was that I would never experience pregnancy. And I think that's what I was more upset about than anything else was that I wouldn't get to experience pregnancy. And so I chose what gave me the ability to have that experience. Um, and then as far as like not doing IVF, I just felt like it wasn't the most genetically responsible thing I could do. And that there would be an enormous amount of guilt that I would feel if my child ended up having CADASIL. And I knew, and there was a way I could stop it, and I didn't. Like, I don't feel like my dad should have that guilt because he didn't know. And they didn't have IVF with PGTM or any of that back in the 90s. So it wouldn't really be fair to put that pressure on anybody else.
Yeah, I kind of agree with both you guys. So I definitely, when I found out that I had CADASIL, I wanted to make sure if I was to have kids, that I would not be passing that on. Um, it's, I'm sure you all have experienced most likely your parents getting sick from CADASIL. Um, and that has been a, just so hard to see. And so if I could do something to prevent my future family from having to go through that, that was important to me. I didn't date my husband as long as you, Alyssa, did, but for probably like 4 years before we got engaged. And so he had seen my mom's decline in that, even that amount of time. And so he was very much so on board, but it's also like, getting married, you are realize that this is going to be me probably down the road, and you need to be on board with that too. So just being open with your significant other as much as you can, like be on the same page, not only like having kids, but this is probably going to be me down the road. So if we do want to have kids, this is one way that we can carry on, our family without having to be worried about what's going to happen to them. But you still, as a parent, worry about what's going to happen to them, right? So we may kick out this CADASIL thing, but there's so many other things that you could either pass on or just crazy accidents that can happen. So your mom brain is still worried constantly, but it's one thing less that you really have to worry about carrying on. So I know that my sisters didn't get tested for CADASIL, and so they're very worried that they maybe like they feel like they did a disservice, which nobody should have to feel that way. To their children, like, shoot, we didn't know this when we had kids. Now what do I do? But they want to wait until the kids are old enough, and then they will go ahead and get tested. But yeah, it's just one way to eliminate it from our family. One way to hopefully, like even my husband, if he had to see our kids go through that in the future, I think that'd be very hard on him. One thing I didn't say is we did not do the postnatal testing for CADASIL. We were kind of in our mind, like we did pretty much everything we could to prevent this. And at this point, we're not going to change anything, right? They're here, they're as healthy as they can be right now. We tried to do our best to prevent it from carrying on, but yeah, we didn't do, and I'm not saying that that's the right choice or the wrong choice by any means. But it wouldn't have changed anything for us. So we didn't do that.
We also did not. And I really like kind of looking back on what my parents did, I really respect their decision not to test us when we were young, because they didn't want us to feel like our dreams were limited.
Mm-hmm.
Like, oh, we'll just end up like dad. Like,
Mm-hmm.
my dad had his first major stroke at 40.
Mm-hmm.
Like, nobody wants to think their career is going to be over at 40.
Yeah.
And so I wouldn't want my daughter to like go through life thinking, well, it doesn't really matter what I do because
Yeah.
my career is going to be over at 40 anyway.
Yeah.
Thank you all for sharing your answers and your experiences. It's very valuable. And we did have another question, which I think will definitely be extremely valuable for our community, which is what is one piece of advice that you would give that you would all give for someone with CADASIL who is about to go through the IVF process?
Do not expect it to be easy. I'm learning that I am the anomaly. I did one round. I got pregnant on the first try. That is not normal. Also, I would say start early. I had my egg retrieval at 28. So I was still pretty young. I had my first baby at 30 or 29 and my first stroke at 29. So it, you know, it gets real fast, or it can if it happens to you, unfortunately.
Yeah, I mean, even with studies and if they do the whole AMH and however old you are, like they told me, I think when we first started, I was 30 or 29. And they had already told me at your age, only half of your eggs are going to be good. And I'm like, oh, okay, that's something to hear, right? And then you hear all the other statistics that go along with it. So certainly try to, start sooner if you can. Um, but really it can be so different for everybody. Try to be as relaxed as you can through it. Make sure you do a lot of research on the places that you're going, and kind of what their protocols are compared to maybe other protocols, like Dr. Russo was talking about, the letrozole, with the estrogen and whatnot. You want to be as safe as you can, but you're also kind of, gosh, how much hormones am I putting in my body that this is going to be great for me either way. But I would try to meet obviously with a neurologist first to kind of see what they may have to say, because certain medications are not going to be safe that you are probably taking for this IVF process, or when you're pregnant, or when you are postnatal. There's different medications during all those times. So that would be important. And then really once you get to that transfer point, it's kind of out of your hands. I think I had the last two transfers that I had, a great doc, and just really made me feel at peace and at ease with what I had done. Now there's not too much that you can do. Just try to relax, which is a horrible thing to say to somebody, but not really. I mean, it's true. But and it may take multiple rounds. And it's okay to try one round and you're like, that was way too much on my body, I can't do it again. That's fine. But relax the most you can. That's probably the biggest thing. I don't
And just
know.
know that the entire process is going to feel totally out of your control.
Mm-hmm.
It's very hurry up and wait.
Yep.
Where you are in your cycle, it's like, oh, you need to come in right now for testing. You have 3 days. And then you run in, and then they're like, okay, so in 4 months, we're going to do this. And you're like, well, why did we have to rush then?
Mm-hmm.
So it's very hurry up and wait, which I was not expecting.
Mhm. Yeah, it's a lot of what Natalia and Alyssa are saying resonate, hold on to hope. I'm still in the thick of it, got kind of been through this and feel like a bit of a veteran in the IVF experience, but lots of different ways to be a mom, a parent, so, keep that in mind too, that you can get really fixated on the results and the numbers and the stats and the hormone levels. And, sometimes that can contribute to the stress. So, take care of yourself and your body, eat good foods, get the sleep, do things that are restorative. I know it's hard to say don't stress, but, try to limit alcohol, caffeine, those things, and just focus on your well-being, because you are the vessel, you and your partner both, guys aren't out of this either. You have to watch your alcohol and your caffeine as well, in your lifestyle, because, that contributes to the healthiness of the baby as well. But hang on to hope and find your community, find people who you can talk to, because it can be an isolating experience and you can blame your body a lot. And it's not your body, it's the miracle of life. And, it's crazy that babies even exist when you look at the reproductive process and conception, and everything that has to line up perfectly. The stars have to be completely aligned, and even if we try to control as much as we can with science, nature has its way. So, but good luck, and we're all rooting for you.
Yeah, there is or are definitely some good YouTube people to follow, some different REI docs online that can give some really good advice too. Obviously, you need to listen to your doctor, but like information of what would be good choices to eat and what we could add to our diet and to our vitamin regimen and whatnot. So there's some good resources out there as well. So definitely tap into those and definitely try to have talk to other people who've gone through IVF, not necessarily just people with CADASIL, but other people that have gone through different IVF experiences. Obviously, I don't know how new everybody is to this, but you can't do IUI. You can do IVF without the PGTM testing, but that's not going to um, not have you get CADASIL. You can do the PGTA, which we did add on. That's just kind of eliminating other things from like say you, oh yeah, I know that my embryo doesn't have CADASIL, but well, it could have other chromosomal issues. So if you ever implanted one of those, well, that might have helped you in one goal, but maybe not the other. Or you might miscarry because you implanted one that had an extra chromosome or something like that. So I
Or
would probably, but you need to talk to your IVF doc on whether or not to do both kinds of testing. But anyway, just making sure that you really have a lot of questions when you go into your IVF journey and try to get as many answered as you can. Yeah.
and I would say if you're young and you're single and you're not really sure what you want to do, maybe consider egg freezing because you are young, you will have healthy eggs, hopefully.
Mm-hmm.
Um, and that way you can go ahead and kind of get a jump start on the process. And that way, in the future, if your future husband comes along or future partner, whoever it may be, and you're like, yeah, we want to have a kid and we want it to genetically be her kid, um, you can still do that. Um, not that it's bad not to, but just knowing what we've experienced, it may be something to consider.
Yeah, I definitely wish I could have done that, but I had no
Oh,
means
I
to do
had
that
no
when
idea.
I was in college.
Oh, yeah.
But it would have been a very amazing thing to do and just less work on our body at as you get older and maybe your CADASIL has gotten a little worse or your symptoms have gotten a little more progressive. It probably would have been nice to not have to go through a whole egg stim at that point. I do think that that took a huge toll on my body going through it so many times. But once again, I think it's been worth it for me.
I also want to add kind of one more thing. Um, when I had my baby, so we had to do an emergency C-section. One of the things I had put on the table and that I asked for was that if we ended up in an emergency C-section, to go ahead and do a tubal ligation for a couple of reasons. One, I knew that I should not have been on hormonal birth control, or I should not have hormonal birth control. Number two is that I knew I was never going to naturally have a kid. That was never my goal. So there was no point in having fallopian tubes. I didn't need them for IVF. I can do as many rounds of IVF as I want to without them. Um, just putting that out there for
Yeah,
anybody.
actually, I did that with our most recent. There's been studies about it actually decreasing the risk of ovarian cancer as well. Something else I had to speak, my maternal fetal medicine doc had me speak with my IVF team just to make sure there's no reason that that would change my outcomes for future IVF as well. But yeah, that was a part of my recent C-section. We have one embryo left, so hopefully I don't have to do anything like that. Another stim, but it wouldn't affect it either, like she said. So something to consider if you are planning for the future. But yeah.
Yeah. And my plan was that if I ended up having a vaginal delivery, I would go back, I think like 6 or 8 weeks after and have a laparoscopic tubal ligation. But tubal ligation was always a part of the after having a baby picture for me.
Awesome. And I'm just going to share the screen with all of your contact information for any of our attendees who have any questions. We have Dr. Russo's email, Alyssa, Karima, and Natalia's emails. If you have any questions for any of them about their experiences and would like to learn more about their specific experiences with family planning, IVF, or anything that we talked about today, these are their emails. and the recording of the webinar will also be posted to our website. Thank you again to our amazing speakers and our Catskill community members. This is such an important topic, and we're really glad that we were able to have such an amazing panel of speakers and Dr. Russo to kind of share a diverse array of experiences and information on this topic. So yeah, you're all awesome, and thank you again.
Thank you for having me.
Yes.
Thanks for having this important discussion. It's so, and hope to see another round, and hopefully we can get some more perspectives next time around too. But yeah, I've learned so much through this, even as a panelist. So thank you.
Yeah, it's great to connect with other people who are going through similar things. So always here to help out as much as I can. Yeah, thank you for having us.
Awesome. Great. Well, thank you again, everyone, and I hope everyone has a great rest of their night.
Thanks, guys. Bye.
Bye.